Hello everyone. The medicine we are going to talk about is Aceticum acidum. I have already discussed it from Allen's Materia Medica, and there is Allen's keynote and Kent's Materia Medica. Now I also read from other books, so I tried to draw a picture of Aceticum acidum so that it becomes very easy, and cumulative study helps us to grasp the real picture of the disease, real picture of the medicine. So without further ado, let's see what acidicum acidum actually is. So we have already seen that it's if you focus on the constitutions, it is specially applied in case of chronic diseases, whichever we saw, mostly on chronic diseases. In acute diseases, very rarely we use acetic acid, and we'll see later on what are the particular symptoms where acetic acid can be applied. So first see that the hypovolemic shock. No, rather focusing on the hypovolemic, focus on the shock part. This shock is not an electrical shock. It may be due to any shock. It may be due to injury or due to any surgical shock, maybe due to anesthetic shocks or any kind of chronic hemorrhage. That means bleeding from any orifice, can be from mouth, nose, ear, parectal, even on paravaginal. So there is huge and lots of amount of bleeding. So resulting of which there is profound anemia. So the features of anemia, debility, pale, body become lean and waxy face, muscle become very laxed, and such symptoms of anemia. Or any wasting disease, the patient suffering from wasting disease for long, and because of which the profound anemia or the profound sickness or emaciations prevails. For example, in case of tuberculosis, diabetes, chronic diarrhea, dropsy, etc. So these are the disease where patient suffers for long, and these long standing sufferings resulting of profound weakness. And if there isn't any wasting type of disease, there may be acute wasting disease, or there may be any history of wasting disease because of which now patient suffers from profound weakness. So this is the chronic constitutions. I would rather say this is the constitution of acetic acid. That means in a patient coming with this history, we can think of acetic acid. Okay. So the prostration and weakness. Okay. And the behind the prostration and weakness, we must keep in our mind. Now, see, one most important symptom is that Kane says patient feels bad with constipation, hemorrhoidal constipations, with often alternate with rheumatism, but patient, it would be T, feels good while in diarrhea. That is very important feature. Kent, I have already discussed in Kent Materia Medica. So similarly, I just keep the line here. That is the simple that patient whenever sometimes he has constipation, sometimes he has hard stool, and sometimes he has soft stool. Diarrhea does not necessarily means frequent stool more than 200 gram per day, and constipation does not means that 2 or 3 days interval or obstipation any kind of. It is simply referring there is hard stool, very hard stool, and soft stool, or going 2 or 3 times per day. Now, when the patient having soft stool, the patient feels relief from all the sufferings. Like you will find in case of Jincum or lachesis, where there is a release of other sufferings with the release of stool or menses or any kind of flows. Similarly, when there is a diarrhea, when there is a much more flow, the patient having good healthy state, patient feels better. But when the patient having the constipation or hard stool or patient, stool is not satisfactory. Okay, in that situation, patient feels that there are other problems coming and going in his or her body. Mostly the hemorrhoidal constipation, very important. That there are parvaginal par rectal bleeding, and along with there is constipation, and this alternate with rheumatism. This is very important. So whenever patient have constipation, there is rheumatism associated with. But whenever patient has diarrhea or diarrhea like symptoms or soft stool more than 2 or 3 or 4 times per day, then patient feels good. So this is one of the peculiar symptoms of acetic acidum we must remember. So whenever we are prescribing acetic acid, we must ask the patient the bowel habits. So in short, prolonged prostration, profuse thirst, loss of appetite, night sweats, which I have discussed in Allen's keynote, copious urine, and constipation or diarrhea, one of any, is the feature of actual acetic acid. This is the makeup of acetic acid. Now, in such patient, we can think of acetic acid if they suffers from the following particulars, or apart from these particulars or anything else. We must take acetic acid for once in our mind. So, uh, the prostration and reason behind it, profuse thirst, there is increased thirst as we have seen, but no thirst in fever, also discussed in Allen's Materia Medica, we have seen. Loss of appetite, so no appetite but increased thirst. And because of this thirst, there is mostly night sweats and copious urine, more water intake resulting more urine, pale urine. It is not hemorrhagic urine, maybe hemorrhagic as we have discussed hemorrhage from any outlet of the body. So copious urine and the bowel habit shows constipation or diarrhea. If patient is constipated, then patient is a little bit of anxious, patient having problems, other diseases, but where patient have a diarrhea, he feels otherwise I'm good. Okay. So this is all about its constitution and in which cases we can think of as a disease. Now come to the particular symptoms where patients presenting complaint will focus on the patient's presenting complaint. That means what patient represent at first when he comes to your OPD. Not necessarily he will always come with the complaint of weakness that doctor, I am very weak after this kind of suffering. So this will not be the patient language. So the particular symptoms are the language or the particular symptoms are the reason because of which patient comes to us. Let's see. First particular symptoms. Boric says that epithelial cell carcinoma, any kind of, I have already discussed that any kind of wasting disease, it may be tuberculosis, diabetes, it may be cancer too. So where patient lose body flesh, you know, patient lose weight. So it may be any kind of carcinoma. Mostly it has been seen that epithelial cell carcinoma. So it may be basal cell carcinoma, squamous cell carcinoma, transitional cell carcinoma, or any adenocarcinoma. Maybe papillary, medullary, mucinous, all these kind of carcinomas are epithelial cell carcinoma. That is any part or organ in our body. So anywhere, epithelial cells are all over our body. So anywhere in the body, carcinoma, and followed by patient's prostration and weakness, and hence mostly burning pain. That is the common feature of carcinoma. It is not the common feature of acetic acid, but it is the feature of carcinoma. So then we can think of acetic acid. So that means in acetic acid, if there is in carcinoma, if we are thinking about acetic acid, pain is not the mandatory feature. It may be there or it may not be. Now this is one of the symptoms where I can think or we can think of acetic acid. Second is chronic bloody diarrhea, as I have discussed, hemorrhagic drug it is a, and diarrhea, and mostly important part, there is a chronic diarrhea. I have already said in acute cases, aceticum acidum is not prescribed frequently, but in chronic cases, it is one of the very wonderful drug. With violent burning pain in stomach and chest, followed by coldness of skin and cold sweat on forehead, and mostly, I have already discussed, night sweats. So, in diarrhea, there are symptoms of diarrhea. So, along with that, there may be association of burning in pain or in chest often that is heartburn like symptoms, or in along with that followed by coldness of skin and cold sweat on forehead, or in night sweat. That is the feature of acetic acid. So in that scenario we can think of uh, acetic acid in diarrhea, chronic diarrhea. Now third presenting problem must be maybe croup or dry cough. Now Allen, and mostly if I say precisely, our Herring, Master Herring have described the calf is very, I mean, wonderfully in his book of Herring's Guiding Symptoms. Now, the croup or dry calf with dyspnea, which aggravate lying on back during inhalation. So these are the features. These are the features of a complete symptom. So there are modalities. Okay, there are causations. I mostly rather say type of onset, and associated symptoms. It is not a concomitance, it is normal symptom, dyspnea. So croup we already have discussed. Uh, it is a laryngotracheobronchitis. So the whole upper and lower respiratory tract, mostly the lower respiratory tract, is infected, and there are sputum or phlegm inside the chest, and because of which dry cough, and maybe dry cough or maybe croup, maybe wet cough, along with the dyspnea, shortness of breath, which aggravates when lying on back. That is the important symptom. During inhalation, it excites the cough. Like, in chronic inherited TB. So in TB or in tuberculosis, there is hemoptysis also. So there is a history of blood. There is the, hemorrhagic diathesis of the acidic acidum. And along with that, patient's body suffers. Along with that, patient become prostrated for long continued tuberculosis suffering. Though in India, we know that in case of tuberculosis, we must apply the allopathic drugs according to our government of India. But in previously, when there was no such rule, in tuberculosis, often acidic acidum prescribed when the patient becomes very weak. There is hemorrhagic tendency along with the cough that aggravates lying on back. This is one of the concomitant symptom, I would rather say. Whenever patient lies back, I mean, it is one of the individualistic symptoms or peculiar symptom. Then the cough excites. Mainly in last stage, not initially. I have already discussed acetic acidum mostly and usually prescribed in chronic cases. So in acute group, we do not think usually acetic acid. When patient has a long standing this type of group due to an underlying wasting disease, then we can think of acetic acid. Okay, can also be associated with hemoptysis, one of the common feature of tuberculosis. Now the fourth point comes, and it is direct patient with pedal edema. If you see the NAS single symptom says acetic acid he prescribed in case of pedal edema. So there are no such cause. The kidney functions are normal, the cardiac activities are normal. No such abnormalities found on the any instruments, you know, uh, any CGs or any blood reports, but still there is no drug induced edema there, but there is still patient having edema on the feet. So in that scenario, if the patient is diarrhea, mostly we have seen that patient complaints is I'm usually okay, but only these symptoms comes with for few days. This is an acute symptom. We can easily think of acetic acid if the patient is thirsty. That is very important. If the patient is thirsty, so thirst intake is good. These are the common feature: loss of appetite. Patient have copious urine. Patient have usually diarrhea, and now patient says, my legs get swelled up gradually, and I do not know why this is happening. All the reports are normal. So in that situations, we can think of acetic acid, and it is a wonderful remedy in case of simply to control the pedal edema, without which comes usually without any cause. Now, if there is a cause, if there is a chronic cause, acetic acid will work beautifully, constitutionally. Okay. Otherwise, it will act in generally in a particular symptoms only. Okay. Next, the fifth symptoms, that is hyperemesis gravidarum. I have already discussed in Allen keynote. Hyperemesis gravidarum is nothing but excessive vomiting and nausea when patient feels, particularly in first and second trimester. First trimester feeling nausea is common, but when it is aggravated or excessive, then you call it as hyperemesis gravidarum. So in that situations, you can think of acetic acid when patient become very weak day by day with increased vomiting. Lastly, no thirst in fever, which is one of the very important peculiar symptoms or very peculiar symptoms, and the fever must be the hectic type of fever. So fluctuant the fever, that means no particular pattern of temperature rise or fall, and usually patient thirsty but says do not drink any water while he is in fever. Okay, so these are the particular symptoms what I have discussed. Now come to the relations. So before coming to the relations, remember the actual what Acidicum acidum is. That is its constitution. Now, where I can think of Acidicum acidum to prescribe, think of such particular symptoms. So these are the clinical symptoms. That means these are, in this situation, Acidicum acidum has been given and with a good result. So not necessarily these are the only particular symptoms. There may be others too. So in background of Acidicum acidum, we must remember the constitution part that holds the Acetic Acid itself. Now these are the present problem. So we must remember all this. Okay. Now finally the relations. Some drugs do not work very good before the prescription of some other drugs. So these are their relations, medicinal relations. We must remember this kind of symptoms. Okay. Okay. So relations. What relations suggest? Number one is bad after arnica, belladonna, maxol, and lachesis. Okay, so in such cases, we do not use acetic acidum. In second case, it says good after China and digitalis. In edema, particularly, when you are prescribed a digitalis, after that you can think of acetic acid. It works very well. In China, when huge hypovolemic shock or loss of body fluids and patient feels prostrated, in that situation, you have given China, but after China, acetic acid works very well. Okay, so these are some clinical tips, and lastly, antidote. It antidotes amyl nitrosomes, carbolic acid, carbovage, opium, and stramonium. So after these drugs prescriptions, usually do not think about acetic acid because they destroy the action of such drugs. Okay, so this is all about acetic acid. In a brief discussion, we will discuss the case of acetic acid later. And if you have any kind of doubts or questions regarding this, feel free to comment, like and share with your friends. If you find this is useful, bear with me. And if you have any kind of case that you have cured with acetic acid, please do share. This will helps a lot. Okay. Thank you. Thanks a lot.